Well, there's not a cloud in the sky and the air is crispy with fried food. It's a perfect afternoon to spend relaxing at the fair. Just don't get too relaxed because we're going to take a look at the skeletal muscle relaxants, also called spasmolytics. These drugs are divided into the central acting agents and direct acting agents. We'll start with the central acting relaxants and symbolize them around the centerpiece of this fair ride, which has an inflatable tube. A reminder that central acting relaxants, which act in the central nervous system, are used to provide short term symptomatic relief of muscle spasms and spasticity. Recall that a muscle spasm is a painful, sudden involuntary contraction of a muscle resulting from injury or fatigue, while spasticity is a neurologic condition where the muscles become stiff and difficult to move. Okay, so the first card of this ride is a taxicab. Not quite as expensive as a ride from Soho to JFK, but memorable nonetheless. Take a look at the oversized side mirror where things definitely appear closer and backward. The word cab is reflected as back for baclofen, and because baclofen is a GABA B receptor agonist, this isn't just any old cab, it's cab B. Now, since baclofen causes hyperpolarization of neurons in the spinal cord, we gave this rider a ponytail that kind of looks like a spinal cord. Baclofen is typically given to patients with spinal cord injuries and spinal cord lesions, such as multiple sclerosis. The next card of this ride is a tricycle for cyclobenzaprine. We're using our tricycle symbol because cyclobenzaprine is structurally related to the tricyclic antidepressants. And that means it shares the same anticholinergic side effects: dizziness, drowsiness, confusion, hypotension, constipation, and urinary retention, which is why the writer here is in fact Alice from the Atropine sketch. We don't know exactly how cyclobenzaprine works, but we do know that it primarily affects the brainstem, so we've given Alice a helmet, but it slipped off her head and is now around her, brainstem. Alright, so the final card on this ride is a bit zanier than the others. It even says Zany Zone right on the side. Zany is for tizanidine. And see that alpha and 2? That's because tizanidine is an alpha 2 agonist. It works by decreasing the release of norepinephrine from the sympathetic neurons. Okay, so these are three important central acting skeletal muscle relaxants to remember, but there are a few others we should mention. Methocarbamol, metaxalone, and carisoprodol. We've symbolized these drugs with a broken metal carousel near the back of our scene. Methocarbamol and metaxalone provide temporary relief of muscle spasms, while carisoprodol, well, should never be prescribed due to extremely high rates of physical dependence and withdrawal side effects. Speaking of side effects, you should know that central acting skeletal muscle relaxants cause significant CNS sedation, which you can remember from this sleeping baby. Expect drowsiness, dizziness, and fatigue, which can affect the ability to drive or operate heavy machinery, especially when combined with alcohol, opioids, and/or benzodiazepines. Skeletal muscle relaxants should be completely avoided in elderly patients due to these sedating effects and drug-drug interactions. Also, with these drugs, watch out for physical dependence, which is why we've included another child who is dependent on his parent. Stopping a muscle relaxant like baclofen, for example, might cause a withdrawal syndrome, similar to alcohol or benzodiazepine withdrawal, because, well, they all act on the GABA receptor. Alright, that's it for central acting. For the rest of the sketch, we're going to focus on dantrolene, a direct acting muscle relaxant. To complete this fair's collection of sketchy rides, here is a trampoline that's made of muscle fibers to help you recall dantrolene, which acts directly on skeletal muscle. Certainly an interesting ride. Well, all this jumping sure does work up an appetite. Good thing there's ice cream nearby, but sadly, it looks to be closed for business. Nevertheless, Ryan's calcium stand will help you remember that dantrolene blocks the ryanodine receptors to prevent the release of calcium ions from the sarcoplasmic reticulum of skeletal muscle. Ah, finally, the source of those fried food smells. These giant flames are a searing reminder that dantrolene is used clinically for malignant hyperthermia, a rare inherited life-threatening disorder involving hypermetabolism of skeletal muscle tissues. Malignant hyperthermia usually occurs in patients who receive inhaled anesthetics or succinylcholine, hence these oh so juicy suckers on the grill. Dantrolene is also used for NMS, that's neuroleptic malignant syndrome, another rare life-threatening reaction to a drug, but this time the culprit is usually a first-generation antipsychotic like haloperidol. Without going into too much detail, NMS depicted by this now more spicy sign usually presents with fevers, muscle rigidity, altered sensorium, and autonomic dysfunction. As far as side effects go, dantrolene can also cause CNS sedation like the central acting agents. In addition to that, dantrolene affects the liver and is contraindicated in patients with pre-existing liver disease. Wait, are those skewered livers? Some kind of fair attempt at pate? Well, it seems this fair pretty much has it all. But to make sure we didn't miss anything, let's take one more stroll down the midway. Skeletal muscle relaxants are divided into central acting and direct acting. The central acting agents are used to relieve symptoms of spasticity and muscle spasms. They include the drugs baclofen, a GABA B agonist that acts in the spinal cord, cyclobenzaprine, which acts mostly in the brainstem, tizanidine, an alpha-2 agonist, and methocarbamol, metaxalone, and carisoprodol. The skeletal muscle relaxants are known to cause CNS sedation and physical dependence. Dantrolene is a direct-acting muscle relaxant that prevents the release of calcium from sarcoplasmic reticulum of skeletal muscle tissues by blocking the ryanodine receptor. It's used for malignant hyperthermia or NMS, but should not be used in patients with pre-existing liver disease because it can affect the liver. Ooh, now that's some spicy stuff.